Hello everyone. I'm Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not-for-profit social impact initiative to promote health for all. The one thing that the ongoing pandemic has taught us so well is that a basic hygiene practice of hand washing has so profound impact on our health that at times it is beyond our imagination. The simple practice of hand washing with soap and water regularly, and especially after using toilets or before eating, has the potential of reducing over half of the childhood deaths under the age of 5 that are caused due to pneumonia and diarrhea in this world. In 2018, 5.3 million children died around the world before seeing their fifth birthday. But what is also notable that the world could also save millions of such lives by ensuring good hand washing practices. Washing hand is also proved to be the most effective and powerful shield for the humanity against the COVID-19 pandemic, which is ravaging lives and livelihoods globally. This has become evident that when people maintain good hand hygiene, it can help them more than medications, vaccines, and many other medical interventions at times. But while we are diligently washing our hands and using sanitizers every now and then, we often ignore greater harbors of disease causing bacteria and viruses on our fingertips, and that are nails and spaces underneath them. Researchers have found that our one single nail hosts more bacteria than the entire hand. But what is more worrisome is that most of us, these shiny cappings get more leniency from us when it comes to maintaining their hygiene and cleanliness. Lack of proper hand and particularly nail sanitation can lead to several healthcare issues and make you visit doctors more often and can even lead to hospitalization in certain cases. During the last 6 months of COVID-19 spread in India and preventive lockdowns and unlock phases, we at IHW Council has been bringing to you authentic health guidance and home healthcare advices from India's top and most admired healthcare experts. Today, we are bringing a movement to make people aware of safe hands and nail hygiene practices, which will help all of us maintain good health and prevent diseases and life-threatening infections, including that of COVID-19. To help us understand about the health threats that we can face if these basic hygiene practices are ignored and what is the best way to maintain good hand and nail hygiene, we have with us today veteran health experts from various specialties and nail and hand hygiene ambassadors. Let me introduce our esteemed panelists for today's special live show on importance of nail and hand hygiene during the COVID-19. So let me welcome Mr. Rajesh U Pandya, Managing Director of Kai India. Mr. Rajesh joined Kai Group to lead the business in India. Kai brings over 800-year-old Japanese legacy of offering highly precision beauty and personal care products to the Indian consumers and adding great value to their daily life. This program is also supported by Kai as part of its public awareness initiatives. And we thank Kai for helping us put together this information for the public. We have Dr. Major Manish Manan, Head of Department Pediatrics and Neonatology in Paras Hospitals, Gurugram. Major Manish Manan is a postgraduate in pediatrics from the Army's Referral and Research Hospital, New Delhi. He comes with an extensive experience of 20 years and has served the Army Medical Corps for 5 years and have has also worked in the premier AIMS in New Delhi. We also have Dr. Silpa Ghosh with us. He's the director of Department of Obstetrics and Gynecology in Akash Hospital. Dr. Silpa is well-known gynecologist, obstetricians, and laparoscopic surgeon who brings with her a vast experience of 23 years and has worked with different reputed hospitals, including Venkateswara, Fortis, and Indraprastha Apollo. We also have with us Dr. Bela Sarma, Additional Director of Internal Medicine from Fortis Memorial Research Institute, Gurugram. Dr. Bela has served in the Indian Air Force as graded specialist medicine for 5 years. He has been associated with the Fortis Group since 2002 and currently is heading the Department of Preventive Healthcare, Health for You in FMRI, Gurgaon. We also have Dr. Indu Balani, an MBBS and MD in dermatology at Balani Skin and Aesthetic Center. Dr. Balani is a dermatologist with 15 years of experience and also is a custom consultant with BL Kapoor Memorial Hospital. So thank you so much all our esteemed panelists today. But before I begin our conversation, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them towards the end of this discussion. Also like and comment with your feedback, and do share this space also on your wall to help many others who may get benefited from this information. So thank you everyone. And let me begin today's discussion by asking Mr. Rajesh Pandya about his experience, that how he saw India sustainably managing COVID-19. And I'm asking this especially from the perspective of he's heading a company with a legacy from Japan, and we have seen that lot of public health hygiene practices followed in countries like Japan has helped them do really better and prevent a lot of losses of life in during the present COVID-19, and also prevent the further spread of the disease. So how have you seen, Mr. Rajesh, India doing in terms of maintaining these kind of or adapting these health hygiene practices faster, which helped us prevent further spread of the ongoing pandemic, and also how it can be further improved by paying little bit more attention on ignored areas like nails when you talk about hand hygiene. Mr. Pandya.
Hello, good afternoon, everybody.
Yeah, go ahead.
India has done really good in comparison of other countries. The best defense against any outbreak is a strong healthcare system. And COVID-19 has revealed how fragile are the health system of countries across the globe. India has definitely proved itself as a forerunner in preparing itself for the pandemic. Of course, the government's initiative of Arogya Setu app is very important. Just recently, our Prime Minister announced that there will be a telemedicine. This program will also help us to make our healthcare better. So, COVID-19 is I would say it's not a crisis, but it's a challenging opportunity. It is giving us chance to see what we have done in the past and what we should do in the future. So far, India is concerned, We are one of the largest manufacturers of nail clippers. We have almost 60 types of nail clippers. And as you know, Japan is one of the best when it comes to the technology and research. The nail clippers research has been done by our group. It's so intensive and in depth that from a 0-year-old child to 100-year-old person can use our nail clippers and keep themselves trimmed. Now, when I'm using the word trim, it's not just mere cutting. We are not a country of knife and fork and chopsticks. We eat our food by hands. So it's very important for us to keep our nails clean. Let me give you an example that in the past, when we used to go to the Vaidnath, I am sure you know what I'm talking about, Vaidnath, and he would say, इनके नाखून में भी बीमारी नहीं है. नाखून में बीमारी न होना तंदुरुस्ती की निशानी थी. Now, this is something very important, and unfortunately, nail clippers is a category which has been neglected. Nobody has addressed nail clipper the way Japan has addressed. And after living in Japan for last 30 years, still my family is in Tokyo, I would say that the same concept of keeping your nail clean we should bring to India. And these are our efforts. Because if I ask someone that would you like to share your towel with your loved ones, you would say no. If I ask someone that would you like to share your toothbrush, you will say no. Then why nail clippers? This is something very important. For me, of course, COVID-19 is a awakening call for the hygiene. Washing hands, keeping distance, social distance. But once COVID-19 is gone, or we have the medicine for COVID-19, should we forget to wash our hands? Should we forget to trim our nails? No. The answer is totally no. Because these are the fundamental things which we are forgetting. Most of the work we do by hands. And while eating, we use our right hand. So our nails are supposed to be unhealthy or with some kind of bacteria in it. We need to clean it up. And how can we clean it up? By keeping it trimmed and maintain it. So this is the thing which I would like to request my fellow Indians. Of course, learned doctors are sitting on the panel. I would like to know their views also. But it is very, very important that a small thing can change your concept dramatically. And this is what my message is for all my fellow
Thank,
Indians.
thank you so much, Mr. Pandya. Before I go to specialist doctors, we have a gynecologist, we have a pediatrician, and we also have a dermatologist. But let me go to somebody who takes care of the whole body, and Dr. Bela Sarma. She is the doctor for internal medicine. Dr. Bela Sarma, we are talking about a pandemic of this scale, which is, kind of has brought the whole world to the standstill. And then we are talking about something so basic, or like, washing your hands. WHO, since the very beginning, and on every press conference or every message, is every day is being talked about that: wash your hands, and give those 20 seconds to, while you are washing your hands. Mr. Pandya is talking about nail clippers. Now it seems
Yeah.
to, maybe apparently disconnected things, because I haven't given any damn
They have.
attention to the nail clippers so far, and it is coming of a very surprising, statement or a fact that we should not exchange our or share our nail clippers.
Absolutely.
I think in my family we have only one nail clippers, which is being used by maybe 10 people. What it is, so grave about it, and what are the health issues you really feel in these, the small cavities in our nails, or not keeping, proper hand hygiene? What kind of health threats we are staring at, and what all can happen if we don't maintain this hygiene?
All right. Thank you, Mr. Kamal. Am I audible?
Yeah, please.
Okay. All
Yeah.
right. All right. So, before we get on to the hand and nail hygiene, there are a couple of things I would like to just discuss. One is that every pandemic so far has taught us something, be it the cholera, be it Spanish influenza, be it plague or anything. They brought about changes in the whole society. There were political changes, social changes, economic changes, and
There seems to be some internet problem. Dr. Bela, it seems we, I think, lost the connection with Dr. Bela. Uh, let me, in between, go to Dr. Silpa Ghosh. Dr. Silpa,
Hi, good
you
afternoon
are
all.
good afternoon. Yeah, you are a gynecologist, but you are a doctor first, and you do know that what all health issues can be triggered because of not good hand or nail hygiene. And as I asked this question to Dr. Bela also, this pandemic, we one of the biggest thing to prevent the spread, we have proper hand washing. And when it comes to hand washing, Mr. Pandya is bringing out a very important information about giving much more attention to the nails, and some very important precautions which we need to take. What is your take on this, and what kind of diseases can happen, including for the women, and also during the period, phases like pregnancy, or maybe for infants?
Yeah, absolutely. So Dr. Bela was right that each pandemic teaches us something. And Mr. Pandya has rightly said that nails are an important part of our hand, which we forget so many times. So this pandemic has taught us, and we doctors already knew the importance of hand hygiene. We used to clean our hands before touching any patient. There were different regimens. You have to use a soap and water or a hand sanitizer to clean your hands for 20 seconds and cover all the areas. In 20 seconds, you're supposed to clean the palms, the back of the fingers, and you're supposed to clean your thumb, and you're supposed to clean your wrist. And what about the nails? So any surgeon knows that before washing for a surgery, they do use a nail brush, which is there in the operation theater, because we know a lot of viruses and bacteria and fungi stay on the undersurface of the nail. So nail hygiene is a very important part of personal grooming, not only for doctors, but for all our patients. And here, because I'm a gynecologist, let me tell you, all the pregnant ladies which walk into my OPD, the first thing I tell them is, please clip your nails, because they harbor a lot of infection, not only COVID-19, all sorts of infections. And though they are reluctant, nails are supposed to be, a part of beauty, grooming and all, but the importance of clipping them the right amount, like it should be 1 to 2 millimeter just above the nail bed, not too short. They should, because that would again disturb the whole balance there. So it's very important to have a nail hygiene, because a lot of bacteria stay there and a lot of viruses stay there. And this pregnant lady, once she delivers, has to take care not only of herself, she has to take care of the newborn. So not only her nails are important, and she has to keep them clipped with an individual clipper, the newborn baby's nails are also so important. And these days we have separate clippers for the babies, newborn babies, because you can't use an adult clipper for a baby. I mean, their nails are so soft and small. So they have separate scissors or nail clippers, which we should use it for them. Otherwise, the infection would be transmitted from one nail clipper to the other, from mother to the baby. So hands and nails, they are very both important to for overall health of the person. Otherwise, diarrhea and loose motions and a lot of infections can spread through the hand and the nails. So hand hygiene and nail hygiene are very important.
Thank you so much, Dr. Silpa. Bringing an important point. Since you talked about that, the beauty aspect also of nails, I would go to Dr. Indu Balani. I'm sure she is seeing a lot of clients and patients coming to her, and she's also providing some medical aesthetic services. Now, Dr. Balani, when people walk in your clinic, especially women, and as Dr. Silpa says that keeping nails of a certain size is very, very important and very critical for maintaining your health and also prevent diseases. What kind of advice you give to your patients and clients when they walk in, and they may not be very keen to actually clip all the nails, which may kind of may not be that a great add-on to their cosmetic appearance.
Yeah. So, hello. I do get a lot of beauty clients, as you rightly said, and they are as concerned about their nails as about their face. So they do go in for regular manicures, and they tend to keep their nails also longer. But I usually advise them that keeping them a bit trimmed, like short nails at least. And if they are going to parlors for the manicures and all, they have to really be particular about the instruments being used, because that is a place where infections can be transferred due to the use of the whatever manicure instruments they are using over there. Plus, they have to take care of the cuticles as well, because it is very commonly during manicures and all, the cuticles are being pushed backwards. So that again, is very, very important to protect the nail. The cuticle has been given to us as a protective covering so that it doesn't let infections creep in below the skin also. At the proximal end, so this end of the nail, you have to be very particular that cuticle does not get too pushed backwards, and you have to keep it moisturized. And plus, moisturization, cleaning the nails is very, very important. So when we are washing our hands, I do advise them, those who tend to have longer nails, although I am strongly against that, I do tell them to keep them short. But if they are keeping it longer, a bit longer, they have to keep cleaning it regularly and keep moisturizing it as well. Plus, take care of the cuticle. And in case they do get infections and all, like discoloration of the nails, they have to get it checked.
Thank you so much, Dr. Rani, and good to hear that you are strongly advising your patients that to keep the nail short. We will come back to you with other aspects also, that if they are not keeping their nail shorts and also not that hygiene meant, what can be the dermatological outcomes on that. But I think Dr. Bela has come back, so Dr. Bela, you have heard my question, and I would request you can continue with that, because we would like to understand that as a internal medicine expert, what all health problems you see if hand and nail hygiene is not maintained. Dr. Bela. You are on mute. Yes, ma'am.
Yeah.
Yeah.
Am I audible now?
Yes.
Yeah, okay. So, like, in fact, I was just talking about the pandemic. I was talking about COVID-19 will go down in history as the pandemic which introduced hand hygiene in a very big way. We in India are, as a nation, taught to wash our hands, clean our hands. I remember school, there used to be an exercise where teacher would inspect each and child's hands and nails to see if they are clean. So that kind of thing is kind of, it's been taught to us right from the childhood. Probably that is why the spread in our country has been, I would say, limited as compared to rest of the world. If you look at the total population, so that is one aspect. Second, I'll talk about from the internal medicine point of view. Now, as we all know, if we look at the skin as an organ, it is the largest organ in the body. All right, and nails are an extension of the skin. So, as internal medicine doctor, we are taught to first look at the nails when we examine a patient. Nails are very important. They tell us about the overall health of a person. Whether the nails are uh, small and pink in color, whether they are pale, whether they are bluish discoloration, whether they are smooth or they have small pits in them, or uh, if a person has been biting nails, so all those things we can see from the uh, nails. Now, as far as diseases are concerned, of course, any condition where transmission of infection is happening from food or water or direct contact also, nails become very, very important. uh, I could actually go on forever, but even conditions like dengue, where bleeding tendencies are there. So I always look at the patient's nails and I tell them, please clip your nails, otherwise you will end up scratching yourself and bleeding very heavily. Uh, in people who are handling food, like cooks and bearers and all, again, when we do their medical examination, nails are one of the most important examination, because I always look at the nails, I see the length of the nails, and if there is anything underneath the nail surface, like this, especially the right hand, people who are right handed. Again, in if we look at COVID, so during COVID transmission, like it's an aerosol transmission, but then the virus is also known to get deposited on the surfaces, and that can get deposited in our hands, especially under nails. So nails become very, very important where transmission of diseases is concerned. Not only that, even where we examine nails to look for certain conditions. So like I said, nails are one of the most important part of our body, and yes, grooming, it is important that our nails be groomed properly, they be clean. And like Dr. Balani said, even people who go to parlors to get their manicure done, there is an incidence of hepatitis B uh, contamination because of pedicure and manicure, which is again, uh, basically that is for the nails that we go for manicure and pedicure, but one may end up getting infections. So nails as such are very important. I think in our culture that importance has been stressed a lot right from the childhood. But it is high time that the world also started learning something from the Indian values and cleanliness. Thank you.
Thank you so much, Dr. Sarma, for bringing out some very important aspects of nail hygiene and overall hand hygiene. You talked about the childhood when we were being inspected regularly in our
Yeah.
schools about the size of our nails and so when it comes to children, now I would go to Dr. Manan on it. uh, Hand hygiene has been attributed to the gravity of child health across the world, and also has been largely associated with the high child mortality rate also, and especially under 5. And as I said in the beginning itself, that almost 50% of can be reduced cost, especially by pneumonia or diarrhea. Dr. Manan, you take care of children, and how do you educate children as well as the parents who come to you to maintain a good hand hygiene and the nail hygiene? And also, what are the issues we can see actually in our child health, if this is not maintained? And not only in the areas where hygiene is a predominant issue, but also in for people like us who lives in metros, but is still somehow ignore in certain cases that how we need to maintain our hand and nail hygiene.
Thank you. Thank you very much. Am I audible?
Yes, very much, sir.
Yeah, thank you. So a very common scenario, we get a child with gastroenteritis who is admitted to the hospital, has come with dehydration. And the mother and the father says, but we haven't given the child anything from outside. He only takes home food. And you look at the child, he's repeatedly putting his fingers into his mouth. So typically happens in toddlers and small children. They have that habit of putting fingers into their own mouth. And it is common, and it's okay to, it's acceptable. That's where the source of infection is. So it is food, water, or dirty hands. So a child will touch on the floor, on the slipper, and then the same hand will go into the mouth. It's so common. So that's the source of infection. That is what we have to, tell our parents, that this is the source of infection. You give a toy to the child, say 2.5 years old child, he'll immediately pick it up and put it in his mouth. Infection is gone inside. This is what has to be taught. A lot has already been talked about by our esteemed panelists on, and you have also spoken, how many infections, how many microorganisms can be there on the nail bed. We all know that. The idea that nails should be clipped and cleaned has also been spoken about. I want to talk on 2 or 3 things. One is we teach our children to keep their hands clean. One thing which I have been stressing in COVID times, and I would also like to convey this to our audience and to all those who are watching this show, I discourage parents from sanitizing their children's hands. Sanitizer contains a lot of chemicals. It contains alcohol. You sanitize that hand, the child will put the hand into his mouth again. He's not supposed to eat it. So we generally advise children to wash their hands with soap and water. That is a healthier practice. I was interacting with a school about a week, 10 days back, and a question was asked by the parents. Should we ask our children to wash their hands again and again at home? So ghar mein bhi COVID ho sakta hai kya? My answer was yes. Not because the child will get COVID at home, but because that way you will inculcate a good habit into the child of washing his hands. Just one simple thing, if we teach our children, before your hand touches your face, you should wash it with soap and water. If this simple thing is followed by the parents, they should lead by example, and by the children, not only COVID, a lot of infections can be prevented, and a lot of mortality and morbidity can be taken care of. Completely agree with the dermatologist colleague who said, yes, we also advise nails should be clipped. They should be clipped in a proper manner. Nail clippers of the size of the child's finger, that should be taken care of. It should be clipped in the proper shape, otherwise they'll end up in getting infected. Infections like paronychia become very painful if the nail gets embedded into the skin, and then it can get pus discharge and pain, and then that can also further cause infection. So that care has to be taken, that it should be clipped in the right manner and in the right amount and regularly. And every time the nails are clipped, the hand should be washed. The nail cutter should also be washed with soap and water. A little older child, thumb sucking is also very common. That is also a source of infection. Nail biting is also a source of infection. So we need to look into those causes as well. Why the child is doing that particular thing. It's not always physical. A lot of times, it is a psychological issue. There may be anxiety, there may be stress. So those aspects also need to be dealt. So it's a whole, it's physical as well as mental. Everything has to be looked into. Parenting, the method of parenting plays a major role. There is one way in which a parent, just gives an order to his child, don't do it. And another way, which we call is authoritative parenting, wherein you explain to the child why you should not do it, how it can cause an infection. Trust me, even a small child as young as 2.5 years old, if you explain it to him, he will understand what you are saying. And lead by example by you doing every time you wash your hands. Tell the child, look, I washed my hands. Now you also wash. So that way, the good practices are inculcated in the child.
Thank you so much, Dr. Major Manan. I think very important points you have highlighted, and I would like to, I think understand a little bit more on those in the next round. But before that, I, would go to Mr. Pandya on it, and you all highlighted, that the nail cutters should be of a specific size. There are nail cutters for the children, which are coming, especially for infants and children, and Mr. Pandya was also talking about that his company makes around 40 types of nail cutter, and that sounds, uh, very, very unbelievable for me, because I know only one kind of nail cutter. So, Mr. Pandya, what are these nail cutters, and what are the specialty, and why do we need 40 types of nail cutters?
See, when a newly born child is there, we need small scissors because their nails are very sharp. I'm sure all the doctors would agree with me. They can scratch their face and can bleed also. So it starts from that early time till 70, 80, 90 years old. We have developed nail clippers which has got LED light and magnifying glass, where senior people who cannot see it properly, still they won't injure themselves and still they can cut their nails. Believe me, I mean, for me, uh, all these doctors, learned doctors, uh, explained and agreed, and of course, we used to wash our hands before cutting the nails and after cutting the nails. Why were we doing this? Because before cutting the nails, if we wash our hands, then the nails will get little softer and easy to cut. And after that, we cut our nails, and then again we wash our hands. So all the germs and the unwanted foreign articles are there in the finger will be washed out. Now, these are the fundamental things which is happening. So uh, I am trying to play here a role of not a businessman, but of educationalist awareness. You need to know what we all know, but we don't do it. That's the problem. We have, as I mentioned, 60 types of nail clippers. Will you believe me? I mean, Japan, the beauty of Japan is they go into details. They have this kind of mind where they go deep into a subject. So when I saw 60 types of nail clippers, I was totally surprised and astonished the way you were. So, why on the earth do we need 60 types of nail clippers? But there are nails which are nail clippers which can be good for inward nails which are gone into the skin. Doctors will tell more about it, but of course, toenail for the feet, fingers nail are harder, difficult to cut. So we have slanted cutter and straight cutter and curved cutter. All these things are very, very important because uh, nails nature differ from person to person. So this is something which I wanted to emphasize, that whether you buy a nail clipper of a high nail clipper or any other nail clipper, please keep your nail intact and checked, because that will take you, as the doctor, one of the panelists doctor told, that we used to see the nails and we can say that if it is pale, then we will find out that this kind of disease this child might have, or this patient might have. So the same thing is this, that नाखून में बीमारी न होना is the most important thing. It's a barometer. So this is the fundamental thing which we need to understand.
Thank you so much, Mr. Rajesh. And yeah, definitely. Now I'm getting a little bit more, aware about it, that we may be requiring so many kind of nail clippers. And as you highlighted that the clippers are even available which can magnify the size of your nail, and you may have a light, and which may be very useful for people with a kind of impaired or lesser eyesight, or at the advanced stage. I'll go to Dr. Shilpa again, and we are almost 40 minutes in our discussion, and it's wonderful to hear so much of important aspect of something so common, and definitely is going to help our viewers also to practice and follow better health, nail and hand hygiene. Dr. Silpa, you are a surgeon, and I saw that even before patients are taken into a surgery room, when they prepare the patient, they clip the nails and then clean it. You mentioned about that even doctors do their nail cleaning before they go for surgery. uh, why patients nail are cleaned before a surgery, and how it is connected, and especially I saw that before you take it for the delivery of the child, for pregnant women, that is the ritual has been followed. Could you bring put in a little bit more light on how it is a medium to prevent certain infections?
Yeah, Mr. Kamal. So not only doctors, the patients also need to have their nails clipped when they are admitted to the hospital and are being taken for any delivery or any surgery. This is because, as we have discussed, all the expert panelists have discussed, that we have a lot of germs inside the nail bed, and this can be transmitted not only to others but to the patient herself if she continuously touches her face, or she touches it anywhere else, for example, to clean herself. If she's a breastfeeding mother, what if she touches her breasts with it? I mean, the infection is going to spread. And if she's going to hold a baby immediately after her delivery, then her nails and hands better be clean. So thereby, not only we clip the nails, we also remove the nail polish again, because we want to see the color of the nail bed. Is it blue? Is she becoming cyanosed? Plus, if we put a pulse oximeter, they say nail polish may also hinder the reading of the pulse oximeter. So not only clipping, removing of the nail polish is also important. And we also recommend the patient during pregnancy and during delivery, So it's a pregnancy and delivery are a happy occasion. It's not an illness. So people want to dress up and have those photo shoots and baby showers and, share it on Facebook and everything. So it's not only a surgery if it's a cesarean, or not only a medical condition, it's a family affair. So they want to be all groomed and all. And sometimes they ask us, ma'am, can we use artificial nails, for example? Again, we tell them artificial nails are a no-no, because not only they harbor infection, they can also, a lot of chemicals are used when you put these artificial nails. So you should not use any artificial nails. You should clip them. You should not use too much of nail polish. It should be used only occasionally. And at the time of surgery, we even remove that nail polish. So because she's going to touch her whole areas, and the baby, little baby whose skin is so soft and delicate, she does. And again, if she's feeding the baby, her own breast would be touched. If she's by chance using a paladay or a spoon, or rarely, bottles are not advised, but again, this infection is going to spread everywhere on the baby products as well. So it's important that she keeps her nails trimmed when she's hospitalized and immediately after delivery as well.
Thank you so much, Dr. Silpa. So now I know that why this ritual is followed, and why this ritual need to be followed not only before you go for delivery or a surgery or any other medical, I think, procedure, but it needs to be done on day-to-day basis also at your home. Dr. Balani, Dr. Silpa talked about scratching. The body can also lead to those infection, or sometimes you see even mentioned that while breastfeeding and touching breast, and maybe that can lead to some kind of infection which can pass on to the children. Uh, Scratching itself is a, I think, big problem when it comes to a dermatological, expertise, and I'm sure you must be getting so many patients who come with a lot of those, skin-related problems, which are majorly sometimes caused by, over scratching and unconscious scratching or subconscious scratching with the large nails, and especially for women, when you have larger nails or you use those cosmetic nails on that. What is your opinion on that? That what kind of patient flow or the complaint you get, and how do you kind of, what kind of recommendation you will give them, that how it can be avoided?
Yeah. So, as you rightly said, we do get a lot of patients who have these small allergies, or sometimes it's just sometimes an insect bite or something. Because of the scratching, that gets aggravated. So, if they have long nails, it also gets infected. Apart from getting added, even if they trim their nails, we do advise them to trim the nails, and sometimes they are scratching it a lot. It might actually result in a very like increasing the allergy, aggravating it to a certain extent. So sometimes we really have to tell them to tie their hands and not to touch the area, because the more you touch, the more you spread it, the more you scratch, the more there is a cycle, it's scratch cycle being getting activated, in which you get pleasure, derive pleasure out of scratching it, and then it again leads to more increase in the number of lesions. And it's not only the skin, sometimes it might get infected, and then you get those kind of sometimes boils or a swollen area all around it. So that is a big problem with the nails.
Thank you so much, Dr. Bela. So I would talk to you on across lifespan of people because of your expertise. As Mr. Pandya was also talking about, that it kind of biting nails, and this kind of practice many times we see in adults also. It is not always that it is the children who indulge into this kind of thing. Sometimes it become a the convenience that if you find your nails bothering you a little bit, and you get into that, and I'm sure you must be getting some kind of people or patients who might have complained about it. uh, what is your also opinion on this area, as well as the kind of one thing which Mr. Pandya talked about, that for elderly age there is a different kind of aspect. So I'm sure there will be a different kind of health problems which can be faced at that time. Keeping nail hygiene may be even more important for them. So I would like you to give us a little bit more light on that how to maintain a good nail hygiene at all ages, and what are the better outcome of it.
Yeah. Thank you, Mr. Kamal. I will not talk about children because that is Dr. Mannan's specialty. But from 18 years onwards, like you said, nail biting. Nail biting actually is most of the times result of some kind of some stress. Some people do it when they are stressed out. Most of the times it is stress relieving habit. And of course, it is a bad habit. It not only it looks bad, it is uh, one can ingest some kind of infections. Also, one can actually end up biting the not only the nails but the fingertips also, and that can lead to a number of infections. Like Dr. Balani has already pointed out that infection from the hands and nails can actually get inside the body, giving rise to what we call septicemia. Plus, there are certain, important structures in our hand. If the fingers get infected, sometimes the whole hand can get infected, or even the arm. So it is again, nail biting is something which we need to deal with very seriously, especially in adults. If there is some kind of stress in person's life, then that person needs to deal with the stress whichever way. Everyone has their own ways of dealing with it, whether it is meditation or medication or changing a lifestyle or whatever. So nail biting is an absolute no-no. Uh, Secondly, said about different ages. I'll talk about the elderly first, because geriatric medicine is kind of my passion, I should say. So elderly people, number of issues are different as compared to I should say younger or middle-aged patients. One, their skin is very friable, which means the skin can break very easily. Second is the nails also become slightly brittle and at times can break off easily. Thirdly, even their capillaries or the small blood vessels, they also become fragile. So what happens is an elderly person, the nail, they may not have bitten or cut the nail, but it can just break off, and that edge becomes sharp, and that person scratches a little bit. That scratch can actually become quite big because the skin is also soft, skin is also delicate, skin is also dry, and the blood vessels as it is are fragile. So elderly, nails are very, very important. Secondly, people who are diabetics, again, nail hygiene becomes very important. In fact, we have a whole chapter of diabetic foot care. Usme bhi, I would like to talk about the nails specifically, because nails, like I said, they are an extension. Our skin is an organ, and nails are an extension of the skin. So diabetics may fungal infection of the nails become so very important. And unfortunately, since nails do not have any blood vessels, any medicine that we give takes a very long time to reach the nails. So any antifungal we need to give for at least 6 to 12 weeks for nail infection. It may appear to be a very small spot, there's a blackish spot on the nail, but it can actually become very serious because from the nails, from the hands, from the toes, that infection can actually travel inside the body and cause what we call fungal septicemia. Uh, in elderly, like I said, even clipping nails becomes a challenge. Why? Because, like I said, nails are very brittle. You cut in one direction and the whole nail splits. So I'm very happy that Mr. Pandya's company is making specific nail cutters for elderly. I was not aware of that. So it becomes very difficult, mainly because at times they are not able to see their own nails, especially toenails, and at times they are not able to clip them properly. In between, I think Dr. Balani and Dr. Ghosh have already covered what all needs to be done for nail health, and Dr. Manan will tell us what to do about the children. Thank you.
Sorry. Thank you so much, Dr. Bilab. A very useful information for, I think, the elderly people also. And I believe, the susceptibility or susceptibility for infections are higher. So I think they need to be more careful about anything which can trigger any kind of infection. Dr. Manan, you talked about sanitizers, and that is something, too much of, I think, sometimes it might be getting overused in families.
Yes.
For example, my own child keep taking sanitizer maybe 10 times in a day or 15 times in a day, and when we actually propose them or we ask actually them to go and wash your hand before eating, they give a the counter option of that can be sanitized. rather than going and 20 seconds washing hand. So I would like you to, because it will be very useful for our viewers also, that what are the, harms of over usage of sanitizer, and when you should not, kind of uh, trade off between hand washing and sanitizers.
Such an important question you have asked. Such an important question. Many a times I go to certain schools to address the parents, teachers, and sometimes the children as well. So often I have seen in different time, a child will be carrying a small bottle of sanitizer. He'll sanitize his hands and eat food. It is something which cannot be done. Remember, sanitizer contains a lot of chemicals apart from alcohol. It is not a consumable item. Sanitizers initially were supposed to be used only by healthcare workers, and the method of using is also very important. Uh, if you ask anybody walking on the road, sanitizer use karke dikhao, he'll put 3 drops of sanitizer in his hands, just rub it, and he says it's done. That's not how you use it. You should put adequate amount of sanitizer in your hands, rub it in such a way that it covers both the dorsum and the ventral aspect of the hand, and keep rubbing it till you dry it. After you dry it, only then you can say, okay, my hands are now germ free. It's okay for adults. It's okay if you are, sensible enough to know, what it is to be used for and not to be used for. For a child, I always say wash your hands with soap and water, because invariably their hands will go into their mouth. That is more dangerous. Number one, from the point of view of consuming what is there in the sanitizer. Secondly, excessive use of sanitizers can also cause sometimes allergy and irritation in the palms. So that can also be, harmful. Washing with soap and water is actually more useful than using a sanitizer, even if you consider how do I make my hands germ free. Soap and water is more useful. 20 seconds of hand washing with soap and water is better than sanitizing. You may use a sanitizer when you are in a hurry, when your hands are not soiled, when you're outside, you've bought something, you're sat back in your car, you want to sanitize it because in case you want to scratch your nose, at least you have sanitized your hands. That's okay. But children, they should always wash their hands before eating food. And as much as possible for younger children, encourage them to wash their hands with soap and water. Do not entertain or encourage sanitizer. It is there on the TV in COVID times, but tell them it's for the healthcare workers. For other people, adults, for us also, we try to wash our hands more often, even in the hospital. I sanitize in between patients. When I come back to my room, I'll always ensure that I wash it with soap and water. I'm sure other panelists, the surgeons and everybody, they will agree with me. The surgeon will also wash their hands, I think, for a very long time with soap, water, betadine, everything dry, and then use a sanitizer and then wear gloves. So hand washing with soap and water is not something you can do away with. Sanitizer is no alternative to that.
Thank you so much, Dr. Manan. I'm sure that the viewers who are watching will get this message. And also, when you are using sanitizer, use in a quantity which actually helps you.
Yes.
These days during the COVID-19 time, when you are walking out and going even for a grocery shop or anything, people put 2 drops of sanitizer on your hand, and you expect that you are germ free, and they expect you are germ free. That may not be the right way of doing it. Dr. Manan, a small question. We have got most of the questions. We got so many questions actually during the Facebook, live promotion, and also from the live audience. I have covered most of them, but one has come up that again, that how to stop children from nail biting. So, is there any specific tip to do that?
Is a very, very important question. This is something which I tell to most of my patients. Whenever you have a disease, you treat the cause of the disease, not the symptoms. So the child is biting his nails. We need to know why the child is doing that. It could be anxiety, it could be stress, it could be boredom, it could be inattention leading into a habit. It could have turned into a tic. Apart from that, certain psychological and psychiatric problems like ADHD, even enuresis, even mental retardation, and conduct disorders, tic disorders, all these things can cause nail biting. As far as children are concerned, you'll be surprised to know if parents in the house, somebody is having a major depression or anxiety or a conduct disorder, their children may resort to nail biting. So we have to, you can't just say, okay, stop biting your nails. You can't say that to the child. You have to understand why the child is biting nails. If you understand there is an anxiety, there are other ways of addressing anxiety which are more acceptable, like, give a ball to the child, ask him to keep pressing the ball if he's anxious, or a pen to keep rolling the pen. This is something which is socially more acceptable, and it won't cause infection, gastroenteritis, and other severe kind of problems. At the same time, take psychological help to address the root cause of the problem. Unless you do that, it will never happen. Remember, if you put on gloves in a child or apply neem or something in his hand so that he doesn't bite his nails, he'll start doing something else. He'll start banging his head, or he'll start twisting something else, or he'll start thumb sucking, or that anxiety will come out in some or the other way. So the root cause has to be addressed always. Don't just treat the symptoms. The cause has to be found out. Parents should understand that. They have to look into it. I think it's a lot to do with parenting.
So the next time, the parents who are watching it, if you see your child biting nails, rather than just scolding him or her, first start introspecting. Maybe you are doing something wrong, not giving enough attention to the child, and
so right.
Which is leading to that symptom. Dr. Balani, there's one question I just quickly take, and we will be closing it then. It is about the use of nail polish. Dr. Silpa talked about that, they remove nail polish before the surgeries and all that. So the audience want to understand that how safe it is to use nail polish, and how frequently it can be done in a month. And, does putting nail polish adds or gives better, I think, habitat for the germs? Dr. Balani, you are there? I think she has dropped off. So can I ask this question to Dr. Silpa? I think Dr. Silpa can also address it.
See, so nail polish has chemicals in it. It's not a natural product. So it can have formaldehyde, it can have toluene, it can have there are 2-3 chemicals in it which may be harmful. So because I deal with pregnant women a lot and ladies a lot, I always tell them that when you buy a nail polish, first of all, use it occasionally. They may lead to yellowishness of nails, and they are chemicals. If they are chipped and you eat, as Mr. Pandya has rightly said, we eat with our hands. So this nail polish can get into your mouth. The products which are used in any of the salons and parlors may not be of appropriate quality. So, and it's good that due to COVID-19, patients are, managing things at home because they are scared of the COVID. So the tools are also not shared besides the other things. So they have their own tools at home and they are managing. So the nail polish, when we buy, we can see if they have these BPB and formaldehyde and toluene. These are things which are harmful for the unborn baby as well. It can cause a lot of delayed milestones, and acetone and other chemicals can cause miscarriages even. So they are not yet scientifically proven, but some studies do have raised concern about these. So nail polish should be removed. It should not be chipped, and it should be used sparingly is what I would say.
Thank you so much. Sorry, Dr. Balani, I had to pass that question on to Dr. Silpa.
She would have more to offer, maybe. She would have definitely have.
She has addressed it well. Would you like to add something? But the question was that how safe it is to use nail polish and how frequently one can use that.
Yeah, I think Dr. Shilpa has addressed it well, and it is not very safe. And there are actually certain types of nail polishes also available now, which do not have these formaldehyde and which are safer, although they do not last that much. So if somebody really wants to use it for certain occasions, they could look for replacement without the major chemicals in it.
That's great. So that means those who definitely want nail polish, Dr. Balani is saying that there is something available for them as well. Mr. Pandya, let me come back to you. And you brought out a lot of those age-old wisdoms also, which we have seen in our families. You talked about that people, there was a practice that you wash your hand before clipping your nails, or you wash after that. I think that is very much practiced by most of the people. And also many times, people ask, especially I get frowned upon when I'm cutting my nails at any place in my house. So my mother or wife starts saying that, this is not the place to cut the nail. And I don't know where is the place to cut the nail. So I believe that is also having some kind of, some some wisdom around it, that why you should not cut your nail at any part of your home, or why, and maybe it is related to hygiene. That's the question one. And the other question which I want to understand, that why specifically we should not share the clipper, as you started at the very beginning, because with that message I may have to go to the market today itself and buy a couple of nail clippers, because we use one in most of the people. So that a little bit more information on it.
Yeah, you better go to a shop and buy Kydale Clipper today itself. It's very important because even the doctors agreed with me that it can transmit germs, bacteria. Particularly, one of the panelist doctor told that a person who is suffering from diabetes and he has a diabetic issues should not share. And these are the things which we know, but we don't follow. I remember when I was a child, my father used to have a toothbrush, and we used to have Bandar Chap Kala Dant Manjan, and we were fascinated by uh, toothbrush because at that time it was expensive. Today, if you see in every household, the numbers of family members, equal numbers of toothbrush you will find. It has become new normal. Same thing can happen that nail clipper, to start with, for us, I would say one nail clipper per family, but then the next level should be one nail clipper per person, my nail clipper. This is the knowledge enhancement and awareness. And what are the things which we have done and which we are trying to do is we have distributed 1,500 nail clippers to Kendriya Vidyalaya, Delhi Cantonment, to the children, for them to understand the importance of a nail clipper. At the same time, we believe that healthcare begins with self-care. We have tied up with Faridabad Fortis Hospital for 3 months program, where the nail clippers would be distributed to doctors and to the discharged patients also. So these kind of activities we will continuously carry on, and I would suggest or request rather Dr. Manish, Dr. Shilpa, Dr. Indu, Dr. Bella, what you have shared your knowledge. I am extremely thankful to you because uh, it is not business, it is health. That's what I believe in. We are selling 7.5 million nail clippers in Japan. Can you imagine? 7.5 million nail clippers we are selling in Japan even today. And here, with 10 times more population of India, we are way behind because we take it easy. We think, oh, nail clipper mein kya hai? Our nail clippers are stainless steel. It has a tray, as Kamal just mentioned, that nails are not very auspicious. I mean, अंधश्रद्धा कहो या श्रद्धा कहो, पांव के नीचे अगर नेल आते हैं तो उसको अच्छा शगुन नहीं माना जाता. What we have done is we came up with the nail clipper which has got a tray. Can you see the tray? It's a nail clipper with a tray where all the nail clippers will be deposited in this tray, and once you are done you can throw it away into the nails pieces. You can throw it into the
Just where.
dustbin wherever your dustbin is. So these are the things. When we are doing this making roti, particularly females who are making roti, cooks who are making atta and water and tel, and they mix it. Definitely, they will bring all the nail dirt into the dough, I'm sure, because if it is not cleaned, it will come, because it is like a rubber. The dough becomes like a rubber, and it will suck it. So it's very important for us to be very careful. And we have innovated, as I mentioned, that Japanese go into details, and therefore, and the best part is, I'm very proud to say that this nail clipper is 100% made in India, in Nimrana, in Rajasthan. We have a 30,000 square meter plant in a Japanese economic zone in Nimrana, Rajasthan. And these nail clippers are purely made in India. Now, this is something very proud for me to tell, because I believe in Atmanirbhar, and we are just importing the technology, but all the labor and all the technology which is being taught here in India, in NCR, in Rajasthan, is done by us. So this is something which I wanted to tell, that whatever it may come, your nails are very, very important. And Dr. Manish, Dr. Shilpa, Dr. Indu, Dr. Bela, anytime if you invite us for any kind of participation of any program, whether in your clinic or in hospital, we'll be more than glad to come and distribute nail clippers, if that serve the cause of healthcare begins with self-care and the awareness.
Thank you
I'm
so
really
much.
thankful to you.
Thank you so much, Mr. Rajesh, for such a generous offer, and highlighting various aspects, and even highlighting the aspect of your products being made in India. We believe that if they start being used in India as well, as you said, we in India are not using as much clippers as are required. With this, I would be closing my session today, and to my viewers, hope you enjoyed and got some really useful information to stay healthy and prevent diseases, especially at a time when we are living under the constant fear of the ongoing COVID-19, which during which we have also learned a lot of good practices of personal hygiene, washing our hands, using masks, going out to the public only after wearing the masks, and also having the right kind of sneezing and coughing etiquettes. I believe that a right kind of nail hygiene also need to be involved in this with the most possible sincerity, because in the lack or absence of this, a lot of efforts and lot of diligence which we put in maintaining our hand hygiene may go in vain, because the germs lives in your nail and underneath them, and you need to be equally careful or more careful about them. Till then, we wish you a wonderful time ahead, and we look forward to see you again with a new discussion, with the new topic which helps you stay healthy. Till then, keep a positive mindset, eat healthy, sleep well, and make sure that you are helping people whatever or whichever way possible to the people who may be requiring your help during this time of COVID-19. Thank you so much, all our panelists, for joining us today for this wonderful session. And I'm sure all our audience liked a lot what you all said, and it is going to help in them, for them to stay healthy for themselves as well as for their family. Thank you so much.
Thank you.
Thank you. you.